Now, live from Seattle, this is Q13 FOX News This Morning.
Well, this year, thousands of us will be diagnosed with oral cancer. And while it doesn't get as much press as breast or lung cancer, it can still be deadly.
This morning, a local dentist explains what to look for and shows us a painless screening technique to look for it. You're watching Q13 FOX News This Morning.
Well, you know, March is National Oral Cancer Awareness Month. Tens of thousands of Americans will be diagnosed with oral cancer this year alone, and the cancer will kill half of them within 5 years. But Mark has two special guests who are here to show us how easy it is to get screened. How's it going over there?
It's going great. And Angela, this is a really important topic. I'm here with Woodinville dentist Dr. Michael Kozarski, who said he wants to go by Dr. K after this. I guess in light of the NCAA tournament, it's good to have you here.
Nice to be here.
You know, I'll go like this because you're already sanitary. And we have a patient here, Betty Pham. You're here to talk about oral cancer and the screening, some cutting-edge stuff that you guys are doing. I want to start out, Dr. K, by just setting a baseline. How prevalent is oral cancer right now, and what are the causes?
35,000 Americans are diagnosed with oral cancer annually, 100 a day. In fact, and then every hour somebody dies from oral cancer, every hour, 24 hours a day, 7 days a week, someone's dying from oral cancer, just in the U.S.
So 35,000 a year. You know, we have traditionally thought of smoking, chewing tobacco users, and drinkers are the ones that get it. Is that different now?
It is. Your typical thought is a male 50-year-old smoker drinker. Now it's actually more females are getting that from the human papillomavirus, actually males and females as well, which is transmitted through sexual contact.
So let's talk about what the symptoms are. How do we know at home if we have it, or do we need to go see our dentist about this stuff?
Well, an oral lesion that's white, that's persistent, a sore in the mouth that lasts longer than a couple of weeks, difficulty swallowing, persistent sore throat, unilateral earache, things that linger on longer than you think it should. 2 weeks is typically how things should heal.
Okay, show us this technique that you guys have developed, or are using, I should say.
On the exam, first things we do is we look visually. But then beyond that, a lot of oral cancers are missed because they're hard to see. So this technology, the Velscope, is a tool that just shines a safe blue light into the soft tissue, and it causes the tissue to fluoresce.
Really?
And there's a filter inside here that allows us to see the different fluorescence from healthy tissue to precancerous or cancerous tissue.
Wow. So
I
how
can
early
see
can you catch it with this thing?
Very early. The very early signs before it's actually even cancerous. It's precancerous. We can catch it at that point.
Wow, that is cool.
It takes about 3 minutes.
Well, show us how it works on Betty here.
So we do our first exam, palpation, looking, then we come to the Velscope, and the patient open wide. I simply just turn on the blue light and just go ahead and look. And I look for the tissue to change in color. Healthy tissue looks green. Unhealthy tissue starts to look kind of black or dark. And so areas that are unhealthy will stand out and become more obvious for me to see from a color change.
Yeah. So how many dentists are using this kind of technology right now? And is it covered under basic insurance that we all have?
Some insurances do cover it. There's only 500 of these in use in the U.S. right now for 100,000 dentists. The sad thing is only 1 out of 4 patients that come in for exams actually have oral cancer screenings done. It should be a typical thing that's done every day. Every time patients are seen, it should be done every time a patient's seen in the office.
Yeah, so only 500 in the U.S. are being used right now. Wow. What is the cost right now?
It's about $10,000 to have that, to buy the procedure or buy the device.
Both.
It's $37 to have it done as an oral cancer screening exam in our office. And for the month of April, it's actually free in our office.
Wow, for the month of April. So what happens, you know, I don't want to, gross people out, but when people get oral cancer, it can be very bad. Give us a worst-case scenario of people that get oral cancer.
Like Roger Ebert on television. He lost half his jaw, half his tongue because of oral cancer, something that was missed. If it was caught early, could have been just a simple biopsy and removed. But oftentimes oral cancer is caught way too late, when it's like metastasized already, and then people end up losing soft tissue.
So what's it going to take to get these in doctors' offices all over the place?
Just more awareness and patients asking for it.
Yeah. Okay, Dr. K, thank you so much. I can shake your hand now. Well, I guess not. You're still sterile. Thanks for stopping by, Betty. Thanks so much for helping us out today. As we mentioned, Dr. K's offering free oral cancer screenings. You can go to NWSmiles, is that right?
Yep.
.com to get more information. That's good stuff. Thank you so much.
Thank you.
All right. Well, Angela, back over to you.
All right. Thanks.